The cornerstone of cancer treatment is preventive therapy, early detection. What does one mean by early screening and how important is it?
So I want to make a quick distinction between screening and prevention. Screening is what you do to a patient who has no apparent disease, no complaints. So literally any member of the population is screened. And if you detect something, that is known as a screen detected cancer. Whereas early diagnosis is different in that you actually seek out a cancer and you are able to diagnose it. Now, prevention is something quite apart because in prevention you know the risk factors and you try to modify risk factors in a patient so as to minimize the possibility of the cancer ever developing. To give you a very quick example, because this is known to everybody in the world, Angelina Jolie was tested with the BRCA1 and 2 gene tests, and she was found to have a lifetime risk of more than 80%. And therefore, she went ahead and had a double mastectomy with a reconstruction. So, this is prevention, where there is no evidence of disease, there are risk factors, and you modify them to prevent the disease. Now, in our country, the practical aspect of prevention can be in the form of tobacco control. I mean, that's the one major cause of cancer in our country. The commonest cancer in males is mouth cancer, throat cancer, lung cancer. All of them are tobacco related. So that is the one intervention that can take away 50% of all our cancers. All ladies need to understand whether they have any modifiable risk factors. There are two types of risk factors, modifiable and non-modifiable. So the modifiable risk factors are known, and they include things like late marriage, late children, late lactation or no lactation, and the non-modifiable factors are genetic factors, like I just told you, the BRCA1 and 2 antigens. So ladies should know about this, and they should also know that screening is possible, very much possible in breast cancer. And the commonest method for screening is by doing a screening mammography. Mammography is an X-ray of the breast, and what mammography achieves very often is to pick up a cancer before it is at all clinically apparent. So before the woman can feel it, sense it, before any doctor examining can feel it or sense it, it gets detected on a mammogram.
Dr. Raja, I want to come to you with regards to the next question. The key question about early screening is that there are only few tests for men and women. For example, for men, it's the PSA, it's mammograms when it comes to women, and pap smears, and maybe the CA125 and sonographies, and maybe colonoscopies for both. So in that case, how do you cover other organs of the body which don't come under these tests?
See, what we need to understand is that in India, more than 1.5 million newly diagnosed cancer is detected every year. That's called as the incidence. Out of that, 80% of them unfortunately present at a stage where they are called as advanced stage and they are incurable. But if it is also known, data-wise, that if we are able to detect these cancers at an early stage, then again 70 to 80% of them are curable. So you can completely reverse the situation and the outcome in these patients. But then comes the concept of what we call common cancers and screenable cancers. The common cancers are the breast cancer and cervix cancer in women, and prostate cancer in men. And then we have the lung cancer and the oral and head and neck cancer in both the sexes, lung cancer in both the sexes, colon cancers. These common cancers really constitute the bulk of the disease numerically.